One of the many controversies in the field of genetics is whether or not we should be performing a test called whole exome sequencing in children or even in newborns. Now, we've done newborn screening in children for decades. What's the difference? Newborn screening done with a heel stick is taking a small drop of blood from a newborn and testing for a handful of genetic diseases for which there's an intervention in childhood that can either prevent or certainly treat the disease at a much, much younger age. Whole exome sequencing is quite different. It tests for thousands of diseases, conditions, or traits, most of which affect adults, and most of which have absolutely no intervention. Some examples are early onset dementia or hereditary breast cancer, for which there is no intervention during childhood. So what are the pros and cons about knowing about this at a young age? Well, some people argue that one of the advantages is that it would really push research forward, and that for children who have a mutation or a predisposition to one of these diseases, they'll be first in line for interventions if and when they become available. What are the cons? It certainly takes away the right of that child, someday that adult, to choose whether or not they want the information in the first place. They won't have informed consent. We don't know what impact this will have on their ability to obtain insurance, particularly life insurance and disability insurance. We also don't know how this will affect their self-image, their self-esteem, knowing from the time they're a newborn that they're at high risk to develop a certain disease. Will they be treated differently by their parents, siblings, healthcare providers, or potentially other people who know their genetic information? There's a lot we don't know about the impact of whole exome sequencing in newborns. There is at least one large study that is aiming to answer these questions in a thoughtful, well-mannered approach. But one thing is very, very clear. Whole exome sequencing of newborns is not a no-brainer.